So the latest on the coronavirus, and the race to vaccinate is in full swing. Miami-Dade County Mayor Daniela Levine-Cava today makes another push to get more residents to get their COVID vaccine shots. CBS 4's Brooke Schaefer is in North Miami with her plan to get more people vaccinated by the 4th of July.
So please come and get vaccinated.
On Wednesday morning, another push for people to get the COVID-19 vaccine, this time outside the Comprehensive Health Center in North Miami.
People are still needing to take the shot.
Miami-Dade's Mayor Daniela Levine-Cava is looking to bump up the county's vaccination rate by the 4th of July to reach a goal set by the Biden administration to have 70% of U.S. adults with at least one COVID-19 shot by the 4th. Right now, Miami-Dade County is just shy of that at 66%.
We're at 66, we get to 70 by July 4th, and we have freedom just in time for our Independence Day.
Diana Kusanova and her mom got the vaccine on Wednesday morning.
We were both off from work, and it was really easy.
But it hasn't been easy getting everyone to roll up their sleeves. In state numbers earlier this month of people who've gotten the shot, 6.8 million are white, about 750,000 are black, and roughly 40,000 are American Indian or Alaskan. Sites like this one should help with access to the vaccine for Haitian and black communities, but there's still the hurdle of misinformation.
A special address to my Haitian brothers and sisters and African American community and the Hispanic community to come and get vaccinated. There are a lot of bad press out there, bad news, talking about vaccines. It's dangerous. No, it is very safe.
1.6 million people have already gotten the vaccine in Miami-Dade County, but still that push to get the number even higher. In North Miami, I'm Brooke Schaefer, CBS 4 News.
As students are now out for the summer and travel and family gatherings pick back up, doctors encourage parents to get their children ages 12 and up vaccinated against COVID. CBS 4's Carly Barnett learned more about keeping kids safe from not just COVID, but also those other germs we may have forgotten about since last year.
Summer is supposed to be the time of year when sickness subsides, but Nicklaus Children's Hospital says this year it's actually the opposite. We may be getting lax on some of the precautions that kept other viruses at bay, but since colds and COVID can look similar, doctors are encouraging children to play it safe and get their shot. Summertime sickness. It's what Nicklaus Children's Hospital Chief Medical Officer Dr. Marcos Mestre says they're seeing a lot.
Common viruses such as RSV, influenza, we really didn't see this past year, and now we're seeing a significant uptick. Typically in the summer, we don't see these viruses, and right now we're busier than we have been even pre-COVID with our visits to the emergency department. I can tell you in our emergency department, our visits are up by 25%.
As soon as we stop wearing masks, it really shouldn't be a surprise that all the other cold and respiratory viruses and illnesses are going to start spreading.
Dr. Jacob Seligson of the Pediatric Associates Education Committee says cold and COVID symptoms can present similarly in children.
With allergies, you would not expect a fever, but of course in the common cold and with COVID, you may get the fever. So I would say if there's any of those symptoms, the first line of defense would be to contact your pediatrician, have the child come in and be examined, just to make sure that whether it's a cold or COVID, there's no secondary illness coming after it, meaning if it's going into the chest or anything worse.
The American Academy of Pediatrics and the CDC recommend the Pfizer vaccine for children 12 and older to protect not only themselves, but also adults in their household.
It would prevent the transmission or illness from being spread to the parents or grandparents, who unfortunately, if they do happen to succumb to COVID, may not fare as well as a younger child.
Sore arm and slight fever are the most common side effects. Dr. Mestre speaks to some of the questions he receives.
In terms of affecting pregnancy in young females, that has not been shown to be true.
There are also rare reports of heart inflammation in some patients 16 and older.
The grand majority of those cases are very mild cases. We've had a few here at the hospital that resolve with anti-inflammatories and do not leave any long-term effects.
He says the risks of COVID far outweigh any vaccine side effects, and he says to continue best practices to stay healthy. Dr. Mestre says 25% of adolescents have actually been behind on their other vaccinations. So he says it's really important to keep up with regular pediatrician visits. Now, they do offer vaccinations here at the hospital 3 days a week for those ages 12 to 21. Outside Nicklaus Children's Hospital, Carly Barnett, CBS 4 News.